Welcome. I'm Deborah Charoux, founder of Practitioner Development UK. We provide quality professional development courses for nurses and allied health professionals. The video clip you are about to see is a sample of the sort of training we offer on our musculoskeletal and minor injury programs. This is one of the many courses that we provide. For further information, go to our website, www.pduk.net. Thank you.
We're now going to examine the shoulder, and for this you need to expose both of your shoulders so you can compare and contrast. And again, you're looking for any deformity, any swelling, any wounds around the shoulder that may indicate an injury has occurred. We're going to start by getting the patient to go through a range of movement, and there are 6 movements with the shoulder. So I'm going to ask the patient to move the arm forward and go as high as they can. This is what we call forward flexion. They should be able to achieve 180 degrees and get the arm against the ear. I'm now going to ask you to bring your arm down, back to your side, and then continue backwards, and we call this backward extension. And you can normally get at least 50 degrees depending on how supple your patient is with this. I'm going to ask you to bring your arm to the side. And now I'm going to ask you to bring your arm directly out to the side and again go as high as you can. And again, you should be able to reach your ear and get 180 degrees. This is abduction. I'm going to ask you to bring your arm down a little bit now and swing this hand across to reach your opposite shoulder. This is adduction. Bring your arm down to your side again. I'm now going to ask you to touch your back. This is internal rotation. And I'm now going to ask you to touch the back of your head. Come down and round. And that's external rotation. These are the 6 movements of the shoulder. If you'd like to bring your arm down. Neurologically, we test on what we call the regimental badge area, which is about here, just below the deltoid. And you test to see that they have equal sensation in both arms. Pulses again, feel either the radial or the brachial pulse to make sure neurovascularly they're okay. One of the other tests we might do for the shoulder is testing the rotator cuff. This is what we call the empty can test. And we ask the patient to imagine they've got a can of drink in their hands. They're going to bring it up as high as they can with their elbows straight. And then I'm going to ask you now to tip the can out and empty it and bring your arm down again. This makes the shoulder rotate. If there's any discomfort on doing this manoeuvre, it's often an indication of a rotator cuff injury. We're now going to palpate the bony prominences around the shoulder, and we're going to start at the sternoclavicular joint here. This is where the clavicle joins the sternum, and this is a ligamentous joint. We're going to feel along the clavicle, and we're going to feel to the end of the clavicle and where we feel a little dip. This little dip is the acromioclavicular joint, again another ligamentous joint and very commonly injured. From here, I'm coming backwards a little bit, and we're going to come onto the acromion and see if that's painful at all for the patient. I'm then going to come forward, and now we're feeling around the humeral head and the glenoid cavity at the front here. I'm now going to turn the patient round so I can examine the scapula, the scapular border, to elicit any discomfort on the scapula itself. And the other area we're going to check whilst we're here is the trapezius muscle, which is the big muscle that comes up here onto the neck, because often this is quite uncomfortable in patients who've had a shoulder injury. The other thing I'm going to do, because you should always exclude a neck problem, is to have a little feel of the actual cervical spine by having a little feel down the midline of the cervical vertebrae to see if any of those are tender as well. And also then just have a little feel either side on the paracervical muscles and see if there's any tenderness there. This is particularly important in patients who present with non-traumatic shoulder pain, because often this is a neck problem rather than a shoulder problem. Okay, you can turn around again now. And that's the shoulder examination.